This is phase 2 of providing services and counseling, which is coping and stabilization. So often used coping skills for those experiencing domestic violence is going to be drugs and alcohol, codependency, suppressing emotion, and self-destructive behavior related to violence. Afterward, a lot of those coping skills that are used for survival are going to continue with the person. It is important to notice that they have to work on those to be able to gain new coping skills that are useful and productive to their life. But there's also the resiliency factor that a lot of the victims note to other victims as saying, if you survived life before or during the abuse, you can survive life after the abuse. What is the purpose of coping, of using drugs and alcohol, or being self-destructive? It's a great question. I would love to tell you. So the purpose is survival, and that is something that trauma-informed care focuses heavily on. It's not blaming the person for the behavior. It's noticing that it's the circumstances of the behavior to survive those terrible moments of your life, to be able to move forward, even if they're not the healthiest. Strengths of the population is surviving even when there's not an option to leave. They adjust and make things work for themselves, which is something very strong to note. Even when people don't support this idea of being supportive of their situation or of their decisions, but they are surviving nonetheless. Diagnosis that are most often related to domestic violence. So I didn't find anything that was related to what kind of mental illnesses are being experienced most often within relationships with domestic violence, because it happens nonetheless. But afterwards, people are experiencing a diagnosis of anxiety disorders, depression disorders, and PTSD or traumatic disorders. One of the unofficial diagnoses that you can use as a professional to describe their experience better is battered women syndrome as a type of PTSD, which is to describe the learned helplessness, self-destructive coping responses to violence, and describing that they may have this learned helplessness aspect to them, and it's not just the PTSD aspect. Intervening to ensure positive coping and stabilization using trauma-informed care. Interventions that are necessary to increase coping stabilization is treatment for PTSD and establishing boundaries for the self and others.